An oftentimes overlooked area that we explore in our clinic is this, what I call this bidirectional relationship between thoughts and emotions and physiology. Meaning, what am I talking about here? In the West, we like to separate mental health from physical health. But in reality, mental health is not separate from physical health. Mental health is physical health. Our brain is part of our body just as much as our stomachs or our liver. And we need to understand that. And there's a whole field of research called the cytokine model of cognitive function. It's research looking at how is the human body influencing our mental health. And this is a major component that I can measure on labs, and we can quantify and see these labs improve their brain health over time. People struggling with things like anxiety and depression and fatigue and many other brain health problems. But then conversely, we have situational things, right? We have a stressful work environment, a toxic relationship, or somebody that's living out a past trauma. That stuff, the external stuff, can influence our physiology. So just like we know underlying gut health issues and in different aspects of hormonal or blood sugar balance can influence how our brain works. Conversely, we know situational things and past trauma influences our physiology. It can throw off our blood sugar, it can imbalance hormones, it can impact our gut health because it's two sides of the same coin. So we have to look at this, and I have seen countless patients, thousands of patients over the years, where we deal with the physiological stuff, but the mental, emotional, spiritual stuff needs to be addressed just as much. So they need to meet in the middle. So what does that look like practically? We're dealing with the physiological stuff in functional medicine, and we're also integrating things like mindfulness meditation and different meditation and breath work practices for people to start to untangle that maybe trauma from their past or their body's reaction to a current stress as well. So there can be more of a grace and a lightness around their life. It'll start to shift their nervous system from a sympathetic, stressed, fight or flight, stressed state into more of a parasympathetic, resting, digesting, hormone balance state. So meditation, breath work, integrating somatic practices, therapies like EMDR are all immensely influential at calming the body's nervous system and getting it more into a parasympathetic state. These are imperative for people to understand. And ultimately, it can move people that are struggling with health issues that maybe they've been struggling with for years in their life. Different autoimmune problems, different things like chronic fatigue syndrome, things like fibromyalgia. There's a lot of science looking at these different health issues and this bidirectional relationship between what's going on in the body, but what's going on from a mental, spiritual, emotional side as well. All of it will impact your health in far-reaching ways.